Hello and welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio for this Health Suppliers segment of the show. Our guest today is Dr. Laine Green, and he's here to discuss with us a program that has to do with headache education. Welcome to Health Professional Radio, Dr. Green.
Thank you.
Thanks. Now, give us a bit of background about yourself.
Sure, yes. So I'm currently an assistant professor in the Division of Neurology at Dalhousie University, which is in Halifax, Nova Scotia, in Canada. I was born and raised in the local area here. I completed my medical school training locally here at Dalhousie University, as well as my neurology residency training. It was during my neurology residency training that I became interested in headache as a subspecialty within neurology, and then I had the opportunity to travel to the Mayo Clinic in Scottsdale, Arizona, to work with Dr. David Dodick, who you'll also be interviewing, to complete my headache medicine fellowship. And I completed a 2-year fellowship, a year of preclinical research, and then a year of clinical headache medicine training as part of that. And then I returned to Halifax and Dalhousie University to continue on with my neurology and headache medicine career.
Now, when we're talking headaches, are we talking about headaches across the board? Are we talking about headaches that are caused by injury, or those that seem to have no physical or outward physical cause, such as migraine or tension, stress headaches? Are you specializing in a certain type?
Sure. So when we talk about headache, that is the general term that has been applied. We're primarily talking about with pain that is primarily focused in the head, face, and neck. Headache is often the general term that is applied to this. A lot of what we would do as headache medicine specialists would deal with what we call the primary headache disorders, the most common of which would be migraine and the related disorders to that. But we also, as headache medicine specialists, would also deal with what we call the secondary headache disorders. So other medical conditions, whether they be neurological or other general medical conditions that could cause headache as a symptom of another disorder. So we would be seeing patients and trying to diagnose what the underlying problem is, whether it's a primary headache disorder or a secondary headache disorder, and then the ongoing management and treatment of those particular disorders based on what the diagnosis is.
Now, you were recently a participant in a program that was offered by the International Headache Academy.
So the International Headache Academy just had its fourth installment, or the fourth meeting of this group. They started in 2014, I believe it was. It might have been 2013. And this is a joint effort that has been put on by the American Headache Society, the International Headache Society, the Canadian Headache Society, and I believe the American Migraine Foundation has also helped as part of the co-sponsors. And obviously there's been generous financial assistance from Allergan to make the meeting possible. And the meeting has been primarily targeted at as a part of a long-term commitment to headache medicine, primarily of those in the beginning part of their career. So medical students, and primarily residents more in their senior part of their training, but also young physicians, either at their headache medicine fellowship stage or within the first 5 years of completing their headache medicine fellowship. They also include clinician scientists and researchers that are involved in headache medicine as well. And I believe it's an excellent opportunity, one, to interact with colleagues at a similar level of training and similar level of career, but it also allows us to interact with more experienced members within the headache community, not just on the clinical side, but also on the clinician researcher side. again, part of that ongoing mentoring process, but also the ongoing learning and educational aspect to headache medicine. It helps further our knowledge and our expertise as we go forward in our career. So it gives an opportunity to discuss interesting cases. It also gives us an opportunity to discuss recent publications that are of particular importance to the field, an opportunity to debate topics that are of potential clinical concern or clinical differences of opinion, shall we say, and I guess, and it also allows to hear both what young people in the field have to feel on these topics, but as well as more experienced members in terms of their impressions and their approaches to the problems that we face.
So talk about maybe one thing, with your extensive experience dealing with headaches, something that maybe is a breakthrough discovery as a result of this meeting, this program, this conference dealing with headaches, especially as so many young people are going to be dealing with headaches with information that, folks maybe my age or older never had at their disposal.
I think one of the nice things about the meeting is that we do get a chance to talk about interesting cases, or sometimes even particularly difficult cases in terms of diagnosing the particular headache problem, or even managing particular headache problems, potentially when the first line or traditional therapy options that we would have would perhaps not working, and that can be a particularly useful thing. So when you have a multitude and a vast array of experience in the audience, I find that particularly helpful then to be able to take that information back to the patients that I see, to then have the confidence to then go forth with potentially different treatment options that I might not be as accustomed to using, but having that experience and guidance from others in the same field gives me the confidence to go forward and try some things that I may not have used before. It also gives us exposure to some new treatments that are coming along and being developed. So we've been talking about the new CGRP monoclonal antibodies that are in development, that are entering into phase 3 clinical trials, and the excitement surrounding those as part of the treatment for migraine and possibly cluster headache, as well as other medical devices like transcranial magnetic stimulation was also discussed. So there's some new and exciting things that are coming out as part of its headache treatment, and to hear the expertise from people that have the experience in these areas is reassuring going forward.
How much of the information that you gather at these conferences is distributed to other nations that may not have the access or the knowledge of these some of these new procedures and techniques in treatment and diagnosis of headache?
I guess in terms of the distribution, I would not be able to. I guess I don't know that directly, although in terms of trying to attract applicants and participants to the International Headache Academy, so there's international representation in terms of the delegates that attend the meeting. So I guess primarily it would be from the experience that the individuals are having, so both national, continental U.S., Canada, and international representatives. So they're then taking back the experience and the knowledge that they gain from the International Headache Academy, and can then take that back to their area that they're working in, and share that experience and share that knowledge that they have to then further the treatment and care of headache disorders in their own area. There has been some discussion of potentially publishing the content of the International Headache Academy, although I believe the details have not been completely firmed up on that.
Now, in wrapping up, where can our listeners go online and get some more information about the International Headache Academy and Allergan as well?
So for the International Headache Academy, probably the best two sites would be the American Headache Society's website, as well as the International Headache Society's website, of the two best sources.
Well, I thank you for talking with us today.
My pleasure.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, talking with Dr. Laine Green, assistant professor at the Division of Neurology at Dalhousie University in Nova Scotia, and he's been here talking about his involvement in an a headache educational program that was offered by the International Headache Academy in Los Angeles. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.